Good evening, ladies and gentlemen, and welcome to Reference Point. I'm your host, Dave Cokerhook, and with me this evening I have the privilege of having a friend of mine who has been involved in an area that I find to be extremely interesting and important, and we're going to talk tonight about diabetes, actually. And with me is Nadia Al-Samarre, who's the editor-in-chief of Diabetes Magazine, which is both an online and a hardcover. As a matter of fact, I have some of your publications right here. Welcome, Nadia. It's a pleasure to have you on Reference Point.
Thank you for having me.
You know, we've been trying to actually work this out scheduling-wise for a bit of a while, but your schedule and my schedule has been so challenging that we haven't been able to do it, so I'm real happy that we're finally able to make this work today.
Great.
So you drove down here from Marin County, which is
Yes.
where the headquarters is for the magazine. Is that correct?
Yes, Diabetes Health Magazine resides in Novato.
Novato, okay. And you've been doing this now, I forget, I was looking at the data the other day, but it's been how many years that the magazine's been published?
22 years.
22 years, which is a long time. And how did you manage to get into this? Because you haven't always been like a publication person, a magazine type person, have you?
No, I was formerly a stockbroker in San Francisco, and my former husband was an actuary who has type 1 diabetes. And we were interested in leaving corporate America and starting our own business. We wanted a mail order business, and we wanted to go and live in the country somewhere and have a farm. So we thought if we started a diabetes supply store, we would be able to have the life that we wanted. And
because he had diabetes and he was utilizing some of whatever that material is, and so it seemed to kind of,
yes,
okay.
We understood diabetes because he was diagnosed with type 1 diabetes at the age of 17, so he's had diabetes for 38 years now.
Right.
And we knew the disease really well. We knew the challenges that people have to cope with on a daily basis. And on my side of the family, we have type 2 diabetes, so I was more familiar with that. So they're a little different, but similar in terms of the challenges of caring for a chronic disease.
Okay. And so, and that started out as a material, whatever you call the equipment, or not equipment. But
well, no, when we started our mail order business, it was called Sugar Happy Diabetes Supplies. It was a store that we had in the outer Richmond in San Francisco. And people used to come in, and some people would come in and open up the door and say, "Are there enough people here to keep you in business?" And we'd say, "Oh, you'd be surprised how many people there are."
Yeah.
And over time, what we learned from having a mail order business and talking to people on the phone and having people come into the store is that people were generally misinformed about diabetes. Either if their healthcare professional was misinformed, then the patient was misinformed.
Right.
And so what we decided to do was start a live radio talk show called Diabetes on the Dial. Mm-hmm. And we had LifeScan, that's a Johnson & Johnson subsidiary, sponsor the program for us. And what we did is we invited all the luminaries in the industry and had a live radio talk show for people that wanted another opinion about some issue that they were having with their diabetes. For example, if you have to inject insulin and you're allergic to the syringes, someone would call in and ask advice ask for advice in terms of what the different options were.
Right.
Over time, people started calling. As we built our audience, people would call and they would ask us if we could transcribe the show because they couldn't listen to it. So we started a publication called Diabetes Interview because we transcribed the shows from the radio.
Got it.
And we maintained that name through 2006, where we decided to change the name of the publication because it reflected our current editorial style. Mm-hmm. So we've changed from interviews to doing mostly we write inspirational stories, business briefs, research reports. We have type 1 writers for us, type 2 people that write for us, recipes. Mm-hmm. We'll write about medication, low carbing.
And you have actually, if I remember correctly, you have a specific publication that is targeted toward the consumer, but you have another one that's targeted toward the pharmacist. Is that correct?
Yes, we actually have a digital magazine by the name of Diabetes Health Pharmacist, and that goes out to a list of about 10,000 pharmacists. And we also work with pharmacy students to encourage them to learn more about diabetes.
All right. You know, Nadia, one of the things you said just a little bit ago here when you were talking about the radio show is that one of the things you came to realize is that people had all these misunderstandings. They really didn't know what was going on. Now, has that changed any in the last, since that? I mean, how was it a question of awareness, or was it a question of understanding back then? And is that question still the same today?
I think it's the same. Awareness. People still don't really know what diabetes is, and people that have diabetes, when they used to come into our store and I would speak to them, they would say, oh, I'm on insulin. And I'd say, oh, what insulin are you on? And they'd say, oh, I take a white pill. Well, insulin doesn't come in pills, it's a liquid. So even though someone has the disease, they may not always be aware of how things work for them.
You know, it's talked about a lot, and there's a lot of commercials on TV for the meters,
blood glucose meters,
right,
yes.
and all that sort of thing. So there's the apparency that this thing called diabetes is something that everyone, quote, knows about, unquote. But I'm getting the sense, for me personally, and from what you're saying, is that for the most part, though people know it exists, they don't really understand what it is and how it impacts the body, and what the difference between type 1 and type 2 are, and all that sort of thing. Am I reading that correctly?
It's complicated. Yes, a lot of people, if they, for example, when they first get diagnosed with diabetes, the first thing they're going to think of is someone they knew that got their leg amputated or they went blind. They always think of the worst things possible.
Right.
When you have diabetes, you can lead a normal life if you can maintain normal blood sugars. So it really depends on your therapy.
So let's go and see if we can into more of a definition thing here then, because what is the difference between type 1 and type 2, and how do they, what's the impact on an individual if they have one versus the other?
Okay. Well, let me just back up a little bit and say diabetes is a chronic disease where someone's blood sugars are too high. If you have type 1 diabetes, which used to be referred to as juvenile diabetes, that means that you are insulin dependent, your pancreas doesn't produce any insulin. If you have,
is that a genetic thing?
Well, genetic, environmental, they don't really know.
Ah, okay.
Type 2 diabetes is when you're insulin resistant and your body does not make enough insulin to normalize your blood sugars.
So the pancreas is working, it's just not working to the degree that it needs to.
Right, it's not producing enough insulin.
Okay, okay.
To normalize your blood sugars.
And which is the more common?
The type 2, 90% of the people have type 2 diabetes.
90%?
And 10% are type 1.
And so is type 2 more prevalent? Why is it more prevalent?
Because it relates to diet and exercise.
Ah.
It has to do with our lifestyles.
Okay. So does that mean that there is a way to affect some level of control?
Absolutely. The choices that you make every day will certainly have an impact on your blood sugars.
All right, talk to me about that a little bit more.
Well, if you have type 2 diabetes, generally what will happen is you can control it with diet and exercise. Most people find that challenging, so they will be put on some kind of medication. A medication that can either stimulate the pancreas to produce more insulin, to help them maintain better blood sugars.
Okay. What is the role of insulin? What is it doing? I mean, I've heard it mentioned in the pancreas, and you say it helps normalize blood sugar.
Well,
neither of us are medical people. I don't want to get into all the chemistry type stuff, but it's like what I'm looking at here is I think that for myself and hopefully for the audience out there, if we kind of understand what the moving parts are here, maybe there's a little better chance of being able to take to do some of the right things so that you can either take care of yourself if you have it, or if there are lifestyle things that you do that can be precipitating to ending up having type 2, maybe you can do something to prevent that from happening. I don't know if that's possible, but can you tell me a little bit more about what is it that the insulin thing does?
Well, we all need energy, right?
Yeah.
Okay, and when we eat food, they break down into sugar, and the insulin is what helps the sugar get into the cells, and the cells store the energy.
Okay. Okay, so the insulin helps to then take that process, the sugar, the chemical, whatever that it does to
Right.
the sugar, so that it can go into the cell, so the cell has whatever it needs to do,
yeah.
the things that it needs to do.
Right.
Okay. So the energy comes from the sugars we eat.
Yes.
Okay. And so the insulin, so type 2 diabetes, you said, is one where
you're insulin resistant,
right.
and you don't have, your pancreas is not making enough insulin to normalize your blood sugars.
Does insulin resistant means that when it doesn't work in your system, or does it mean that you're not producing enough?
It means that it's not enough
Okay.
for what you've eaten.
Got it. So you need more to be able to break down the sugars to be able to then go into the cells, and you don't have enough the amount of insulin that's in your system normally is insufficient for the task.
Yes.
Okay.
Yes.
Got it. So, type 2 diabetes, is that where you see people who are taking insulin injections and things like that? Is that?
Well, you can. A good portion of type 2s do take insulin.
Okay.
Because what happens is once they go on medications and they expire the various medications, then they'll go onto insulin. Sometimes they'll combine medication and insulin. But the whole object is to try to keep your blood sugars in the normal range, because what you're trying to do is you're trying to prevent complications.
Right.
Diabetes is called a silent killer because you could do nothing and avoid it.
Right.
And you think you're fine, and then one day everything starts breaking down.
So does that mean at the early stages you may not really know that this is occurring for you?
Well, there are people that have diabetes that don't know they have it. There are people that have pre-diabetes that don't know they have it. The people that have pre-diabetes and don't know that they have it, they could change their lifestyle and impede a diagnosis. So if they change their lifestyle, they exercise, they can avoid getting diabetes.
Oh, okay. So,
and
go ahead.
For people that type 2s that have diabetes, the task is to normalize your blood sugars, just try to stay within a normal range, because if you don't and you tend to have high blood sugars, there are statistical correlations between high blood sugars and certain complications. So what you're trying to do is just prevent that from happening.
Okay. And so let's talk about the diet side of this thing. Because I can see where, I mean, do people just sort of say, this part is a little too complicated, I don't want to try to worry about what I eat, so I'm going to just rely on the medication? And is that?
Yes. Don't we all? Give me the pill.
We'll let the pharmaceuticals take care of it.
Is this good for 12 or 24 hours? Well, people, I mean, the challenge is when you have diabetes, you have to, you always have to consider what you're eating. And there are other factors that play into that.
Is it different for different people, though, in terms of what the diet implications are? Or is it just sort of like, you know, it's pretty well standard, and you know that if you have type 2 diabetes, this and this and this needs to be off your diet?
Well, yes, there's a lot of that we all know, whether you have diabetes or not, but it's the application of that's the challenge.
Okay.
The better diets for type 2 and type 1 diabetes is to have a lower carb diet, because then you don't have those blood sugars that are shooting up, and you're not having to give yourself more insulin or treating a low blood sugar.
So it's the carbohydrate stuff that actually...
It's the sugars.
The carbs break down into the sugars. Okay.
Yeah. So things like pasta, rice, pizza, you know, very, very dense. Those can play havoc on your blood sugars. So those are things that you should avoid. There's a small group of people that manage their diabetes without having to avoid that.
Right.
But overall, if it really has to, it's a discipline. You have to change the way you think about food, and you have to have a daily discipline that you do follow. It makes a big difference. Testing your blood sugar is really important, knowing what your A1C is.
So if you, part of this, it seems to me, has to do with the habits that you develop to be able to then take these regular actions in terms of the food you eat or going to exercise and whatever. And changing habits for people is always a challenge. And it takes a period of time, some weeks or months, to actually do it, and sufficiently enough times that it becomes habitual. So once you've done that, though, assuming that you've got someone who recognizes they have an issue, they're pre-diabetic or they are type 2, and it hasn't progressed to the point where there's major complications, and they recognize what they need to do, and they put in the work, and they develop the habit in terms of eating and exercise. Can they stay at does that reach a stasis point, or do the things then you have to change? There's other foods all of a sudden that create the problem for you that didn't create it before, and you have to adjust your habit activity. I don't know if that's a reasonable question.
No, that's a good question. Stress and being sick will change your blood sugar. So you could do the same thing and have normal blood sugars, but if you have a tremendous amount of stress in your life, or if you're sick, that will shoot up your blood sugars. So there are variables.
Right, okay. But if you get on a routine in terms of the diet and the exercise, you don't necessarily have to change that in a year and a half because something else has developed relative to your...
Right. Hopefully you have a certain practice where you have certain groups of food, you know how much of the foods that you eat, you know the portions for each one. But again, when you're out, you're at a party,
there you go.
Or you go to a restaurant.
It's easy to miss.
You don't know that they're putting sugar in a sauce. There are things that will affect your blood sugars. When you're ordering it, it would seem like it wouldn't make a difference. I like to use the example of the first time I went out with my former husband for sushi.
Yeah.
After he ate the sushi, his blood sugar shot up, and he said, "Wow, what is that?" So I asked the sous chef there, and he said, "Well, we put sugar in the rice to make it sticky." Well, if we known that, and it wasn't something that I would have questioned before, but it made a big difference. So that was a learning experience for us. So just little things as you're going out, when you find that your blood sugars are shooting up, it's good to isolate it and understand what it is,
right,
so you can prevent that.
So what percentage of the population is impacted by this, in terms of, not impacted in the sense of somebody in my family has this, but I mean diabetes it's talked about so much that it seems to be a major epidemic, if that's a right term.
Right. Well, there are 25.7 million people that have diabetes. 18.8 million people are diagnosed, and 7 million are undiagnosed.
Undiagnosed.
And then we have the pre-diabetes group, which is 73 million people. So if you put those two together, we're looking at almost a third of the nation. So it's a huge issue.
So what does pre-diabetes mean?
Pre-diabetes is where you're still experiencing high blood sugars, but they're not high enough to be diagnosed as having diabetes. So you're kind of teetering there. And one of the things that I'm doing, and people in the medical community, and nonprofits and organizations and government agencies, we're trying to educate people more about pre-diabetes, and A, see if you have pre-diabetes. B, if you do, help them get those numbers down so they won't be diagnosed with diabetes. And there's several reasons for that. Outside of it being it is a challenging disease in the sense of that it's something that you always have to pay attention to.
Right.
So if you can avoid, if you can prevent being diagnosed and you're one of the 78 million people, that would be a great thing.
Right. It's funny, as you were talking about that, the thought that came to mind was that there are certain industries here in the U.S. that have a direct impact on this sort of a thing for people. The fast food industry, the packaged processed food industry, you go and stuff you're picking up at the grocery store. And because if the issue has to do with the high level of carbohydrates and or the processed sugars, then that's just like, hey, that's everywhere. I mean, it's hard to go it's hard to eat something if you're just going out to grab something off the shelf or eat that's not going to have some of that tied to it.
And our bodies crave carbs, so it is
Crave carbs.
Yeah, so it is an addictive food. I just had
does the body crave carbs because it needs them, or does it crave carbs because, like, you know, people who are heroin addicts, they get that they need the heroin because, you know what I'm saying?
I think what you're asking is, are they craving it because they're hungry and they need to eat carbs, or are they craving it because they have a strong desire to eat it?
There are times when I know that I need to eat something.
Mm-hmm.
You know, I need more water, or I need to get some salt because I've been sweating like crazy. And you feel different.
Mm-hmm.
Okay, so does the body give signals that it needs to have a higher portion of carbohydrate at this time for these physiological reasons, or do we crave it because we just love our pizza?
We crave it because we love our foods.
Okay.
I mean, there are times where our body needs it. If you're having a low blood sugar, yes, you want to get a glass of juice, eat a banana. You definitely need that to bring your blood sugar up.
Okay. All right. Interesting. So how do we deal with all this processed food stuff in the industries that are actually not helping the problem? I don't know that you can say that they are causing the problem. I mean, you always have a choice as to what you eat, but it's a lot easier if the choices that you have to make are less profoundly impactful on you, on your person. Is there anything going on in the diabetes community to look to impact the processed food industries and the fast food industries in that way?
I've spoken to some researchers at UCSF who have said that they've gone to some of these conferences where all the big food companies are, and they've been in discussion with them. And one of the things that they have said is that they are willing to retool to produce other products. It's just one company is not willing to bear the cost of that. Oh. So if they can come together collectively and agree on that, then they're willing to do it.
Interesting. That's actually a very positive statement.
It is a positive statement. And
like
they've done that before. They retooled in the 80s, and so this is another opportunity for them to do so.
Very cool. Mm-hmm. Very cool. We have just a few minutes left in this segment of the show, and I didn't tell the folks in the audience that we're actually planning on doing 2 segments of this discussion with Nadia about this topic. And so there'll be another 30-minute thing here in a few minutes, but let's get back to this. So that's a very positive indication that there is an interest and a willingness on the part of the food industry to be able to address this. You mentioned earlier there are 70-some million pre-diabetic or something like that, and I'm guessing that number keeps growing as as we add to the population, and so that implies to me that there is an opportunity to impact those numbers in a way that causes them to decrease. Mm-hmm. Yeah? Is that a fair statement? Okay.
Absolutely.
And diet and exercise has a lot to do with that. Very cool. Nadia, I'm going to want to talk a lot more about your magazine and why you have this magazine and what you're trying to do with it and the impact that you're having in the community with this when we get into our second segment. But for now, we're just going to kind of wrap up with some of our discussion here on the how this disease is impactful. I'm going to ask you a question about diabetes right now, and that is, when you look at the rest of the world compared to the United States, is diabetes as pronounced an issue in Europe, in Asia, in South America as it is here in the U.S.?
It's a global epidemic. So I would say yes. There are 333 million people globally that have diabetes. Okay.
And that's a few. That's more than will fit into my living room. Mm-hmm. Okay. And do we find that it is more the developed countries or the undeveloped countries where it's more pronounced? In other words, do we see it in Germany and in England and France more than we might see it in,
Well, the markets that are increasing, which would be surprising to most people, is Asia and India.
The markets?
Or the the patients where the higher diagnosis right now.
Oh, really?
Yeah, is in Asia and India, Eastern India.
Oh, that's interesting.
It is interesting.
And are we seeing?
Because when you think of all the, right, when you're kids, you think of all,
Yeah.
That's not an area that you think is abundant with food and.
Right, but I'm thinking that some of that may have to do with the fast food companies, the American companies that are trying to get a presence. I mean, that's the biggest populations on the planet. You know, India's got 1.3 billion people or something like that, and China's got one something or other. I mean, this is like the two most populated countries in the world. And as a business or a marketing type person, you look at those numbers and you say, wow, we don't need but a small percentage of that population to be able to have a significant impact on our business. So do you think that has something to do with it?
I'm not sure I understand your question.
The increase or the wanting to, you can find a McDonald's on street corners in India and China now than you couldn't 15, 20 years ago.
Yeah, so you're asking me, is there a correlation between the food chains that are international now and the increase in diabetes diagnosis?
I guess that's what I'm asking.
People would say yes.
People would say yes.
People would say yes, especially if you look at like the island area, say Hawaii, for example, that didn't used to have diabetes, but now they have all the fast food places. They have, you know, half the kids that were born in 2000 will be diagnosed with diabetes. Wow.
And on that point, we're going to leave the audience pondering that thought, and we'll come back for the next show and talk more about this topic of diabetes, and specifically Diabetes Health Magazine. So ladies and gentlemen, I want to thank you for joining us today. If you have any questions about what we're talking about today or other concepts for shows here on Reference Point, send us your queries at info@referencepointtv.com, and we'll make sure to take care of it. So Nadia, thank you for being here. We'll talk again on the next segment. And ladies and gentlemen, we'll see you next time on Reference Point.